This is absolutely right if I say that a woman suffers from more dental problem compared to men. Because as a woman, starting from puberty and going towards the menopause, we go through so much changes in our hormonal level, which impacts our general health, but it also impacts our dental health. So for instance, let's start from the stage when a girl enters the puberty. There are lots of hormonal changes which happens in the girls as well as in the boys, but the changes are more evident and more visible in the girls compared to the boys. For instance, in girls, there is a surge of two major hormones, which is estrogen and progesterone, which increases the blood flow towards the gums, which increases the reactivity of the gums towards the plaque accumulation as well. That means a girl will accumulate more plaque and also will have more reaction to the plaque in the form of gingivitis. And this is the age when a girl goes to an orthodontic treatment, because this is the time when they are in the age of 12 to 14, 12 to 15, and they're getting their braces fitted as well, which also adds to the problem in terms of the plaque entrapment. So as parents, it becomes quite important that we make sure that if we see any signs of gum inflammation, which is excessive bleeding, excessively swollen gums, or if we see more signs of cavities or sensitivity in our girls, during that stage, we make sure that they visit their dentist every 6 months and they have their regular hygiene appointment. When I say regular hygiene appointment, I mean to say the professional hygiene appointment. They must be using some fluoridated toothpaste. They should be using some anti-inflammatory mouthwashes. There should be some tweak of the diet as well. So if they can avoid some sugary food or sticky food, that will be more ideal at that stage of life as well, because at the end of the day, we are getting that impact from our hormones. And if we do a little bit of a support in terms of the external health, that really helps our girls in combating any dental problems if they are suffering from it. Another stage comes when some women have oral contraceptives, because oral contraceptives are also changes some hormonal pattern in a female body, which makes our gums more reactive to gingivitis and gum-related issues. So when you're having oral contraceptives, if you see a change in your gum profile or the way your gums look, or if they bleed more, you must talk to your doctor about that and you must get your oral contraceptive changed. If that is not an option, please ensure that you look after your teeth in a better way by visiting your dentist, visiting your hygienist, you're brushing, you're flossing, and making sure you're taking a good care of your teeth at that stage. Then comes the stage which is related to pregnancy. Pregnancy brings a lot of changes in our body, including the changes in the gums as well as in the teeth. Most common problem that a pregnant woman see when the situation happens is the pregnancy-related gingivitis. We also call it as a pregnancy gingivitis. This happens again due to the surge of hormonal level, and there is a surge of estrogen and progesterone. That means now the gums are being more reactive to plaque and tartar. And sometimes we also see there's an associated gum enlargement in a pregnant female's body. Mostly these things start to happen from the stage of like 4 to 6 weeks, like the second month, and this is really at this spike at the stage of 8 months. And once you have given birth, the things get back to normal. So we don't really have to worry about it, but beware that these are the changes you can come across during pregnancy. Another thing is the pyogenic granuloma, which sometimes we see in our pregnant patients, where there is an external outgrowth, mainly on the gum surface, which is absolutely harmless, but sometimes patients confuse that with some pregnancy tumor kind of thing. This is absolutely benign, nothing to worry, and this will also resolve on its own when you've given birth and your bundle of joy is there. So a lot of changes are self-healable and they get back to normal. Some women also get this nausea or an acid reflux in the morning, which also leads to the acid erosion in their mouth. So in this situation, we tend to see more sensitivity, more cavities, or sometimes it's associated with the bad breath that a pregnant woman may come across. Another change can be the dry mouth, or it could be the excessive production of saliva. All these changes are related to the hormonal changes, and these things will get back to normal once the pregnancy term is over and you've given birth. There are a few things that you can do to combat those changes, or just making sure that these things don't become irreversible for you. For instance, if you see that your gums are enlarged and this is very hard for you to brush your teeth properly, make sure you buy yourself a manual soft bristle brush and gently brush your teeth under your gums to make sure that you're not making it bleed too much. And even if it's bleeding, it's absolutely normal, but still be a little gentle with that. Use a fluoride-based toothpaste, gently brush your teeth with that. Use some antiseptic mouthwashes. Of course, you consult with your dentist about it, but make sure you start your dental visits. If you haven't been to the dentist, do start your dental visits from your very first trimester. It's absolutely safe to go to the dentist and get your teeth checked from as early as first trimester. If your dentist suggests you any form of dental treatments, for instance, root canal treatment or any treatments related to the cavities, that the safest time to undergo those treatments is the second trimester, which is from 14th week until the 27th or the 28th week. Sometimes the female get very paranoid about not taking any x-rays while they are pregnant. Well, we avoid taking x-rays, but it's absolutely safe if we have a shield around us so that there's no impact. So these are the few things that we can do to ensure that our pregnancy term goes smooth, our dental health is not compromised, but in case if you see anything abnormal, do speak to your dentist about that. But we have to be extra careful about our oral health during the pregnancy time. Then comes a stage in our life which is a menopause stage, which again brings a lot of changes. Now at this stage, there is a drop in our hormone level, and that also brings a lot of dental changes. The most common change that we go through is the dry mouth, that we see suddenly the mouth feels sticky. Sometimes we see an altered taste sensation in the mouth. Another thing that females go through is the burning sensation in the mouth, also called as a burning mouth syndrome. As we all know, saliva is an extremely important component of our oral health. So having a lack of saliva due to dry mouth, we can have gum diseases, we can have more cavities. We may feel throughout my life I was absolutely well. I was looking after my teeth so well. Why am I having these problems? Well, you can't blame yourself. This is all about our hormone changes which are bringing these things. So in the menopause time or before menopause, it becomes quite important that you maintain your regular dental visits. If you see there is any bone loss happening, which is happening due to osteoporosis, it's always important to consult your doctor about vitamin D or calcium supplements. Hormonal replacement therapy sometimes can help us as well. But from our side, making sure that we maintain a good level of oral hygiene. If we were irregular with the flossing before, buy yourself a water floss, use the small interdental brushes, floss tape. There's so many options available in the market that you can use to make sure that you're extra careful about your oral health. So you see, there's so many stages, and there's so many every 10 to 15 years we go through a different stage in our life. So extra care of your teeth becomes quite important, because of course we can't change these hormonal changes. They are needed for our body, but at the same time, what impact it brings on our dental health, if we are aware of that, we can deal with it in a more predictable way. Another very common reason why women get more dental issues compared to men is the saliva, some difference in the saliva. Well, number one, men have more saliva than us because their salivary glands are bigger. So their saliva in the mouth is more in quantity compared to us, which means they can rinse off plaque and the food particles from their mouth naturally better than us. So because we know saliva is a natural cleanser for our mouth, so having more quantity of the saliva, the men they're getting this regular cleaning, natural regular cleaning in a better way compared to a female. Another thing is the acid pH level and the buffering capacity of the saliva, which is, well, again, better in male compared to the female. That means any acid attack from the bacteria or the sticky food or sugary food that we have, the men's saliva can deal with that better compared to a female saliva. Another difference is the electrolyte imbalance. We have a little more imbalanced electrolytes because of the changes in our hormonal level compared to men. So that means they can deal again with this kind of situation in a better way compared to the female. But the good thing is we have more antibodies in our saliva compared to male. So of course we are winning in that situation. So you see that saliva composition and the saliva quantity is better in men compared to female, and that is also one of the reasons that a female gets more dental issues or teeth related issues compared to men, and we suffer more from the dry mouth, which is also called a xerostomia, compared to the men. So it becomes quite important for us, like generally in our life, we got to be more careful about the health and about our dental health, and that is the only way that we can maintain a good standard of oral hygiene, a good standard of health of our teeth, because we need our teeth for life. And so now you know what is the difference, now you know what to do, and I would just say to all the ladies, go for it. You just deserve best for yourself.